Hello everyone. Today we're going to be discussing about the 100 rupee wonder cancer drug which was developed by Tata Memorial Hospital. As most of us know, we would have seen in the newspapers a few months back that there was this new drug which can help prevent the recurrence of cancer, and it costs only 100 rupees per day. So this news was plastered across all the news channels and YouTube videos, and there was a lot of questions that we were getting as oncologists from our patients. Is this drug actually there? Can we use this drug to prevent the recurrence of cancer? Should I change my treatment right now and change to this medication? So today's video will be discussing the aspects of this drug, what it is, and how, what is the data, what are the studies which give rise to this, and whether it's actually true and whether we should be taking this medicine. So first, what is this medicine? So this medicine was researched in Tata Memorial Hospital, and it's a combination of two components. One is copper and resveratrol. So copper and resveratrol are already molecules which are there in as a nutraceutical or as a supplement in the open market. So what the researchers thought is, when you have treated patients with cancer, when you give chemotherapy and radiotherapy, it releases a lot of chromatin or DNA which exits from the cells, and it can go to other normal cells and cause cancer there. So if you use this drug or this combination, it can release free radicals or certain molecules which will prevent the DNA going to other cells and damaging them. So the first study which was done was in rats, and in rats they checked whether the rats that received chemotherapy or radiation, after that they gave this molecule to see whether the later on this amount of DNA reaching the other cells would be reduced, and whether there would be any free radicals increased. So they found out, yes, this was a positive study. It did decrease the amount of DNA, and it did show that the number of free radicals produced by this drug was in a sufficient number. However, the study did not tell whether the rats lived longer, whether their cancer was delayed or recurrence was reduced, and whether you were curing the cancer in all patients, in all these rats. The second study was based in humans, and around 20 human subjects were given this molecule. And the study, however, looked at the side effects of chemotherapy and radiation, and they checked whether the drug reduced the amount of side effects. So yes, that also was a successful study, but it reduced the side effects. It did not look at improving the survival or reducing the risk of cancer. So based on this, there was a media outburst where a lot of exuberance telling that this is a wonder drug. However, it was a little blown out of hype, because as of now the studies which we said are in rats and not fully in humans, and the human studies did not tell whether this actually prevented cancer from coming back. So what is the relevance right now? Now this drug is still being tested. It is being tested in human subjects, and this time they're looking at it whether it actually prevents cancer in the future, whether it actually reduces the risk of cancer coming back. However, the data is not fully out there right now. We have to wait for the final research output, which will be coming probably in a few years or so. The problems which we have to remember is, rat is not the same as a human. What works in rat may not work in humans. The second point is that this drug may have side effects. It may reduce the benefit of chemotherapy by reducing the chromatin or reducing the release of this DNA. Maybe the tumor cells may not get killed fully, so we do not know any long-term side effects as of now. So as of today, should you consider taking this drug? As of now, the data is not concrete, so I will not suggest that you take this drug immediately. Is it available? it is available online as a pharmaceutical, like a nutraceutical product as a supplement. Online it's available. You get resveratrol, one of the components, in grape juice as well. So drinking grape juice will also give you something for similar benefit. So as of now, we still have to wait for the final data. This drug is not the magic drug as everyone thinks it to be. The Tata Memorial Hospital, after all the media hype, has also released a statement stating that as of now, the standard care which you receive from the oncologist is still the proper treatment for cancer. This drug is just a supplement, but it is not fully tested yet. You can take it if you want. It is available in the market, but let's wait for the final information. So I hope this clarified the question of whether this drug should be taken. Please continue the follow-up and treatment which your oncologist suggests, and who knows, in the future we might have this molecule which will help patients, but only once the final data is there can we say for sure. Thank you.